Okay, welcome to our lecture on sexual orientation and gender identity. As you might imagine, this information changes rapidly, and certainly as a person, a cisgender, straight, white person, I can have a lot of blind spots. So feel free to reach out if you think something is outdated or inaccurate, or if I've got some things I need to add. So Amy Brainer researches siblings, which first off, we hardly do in the field of family studies, and more specifically, how having a lesbian, gay, or bisexual sibling affects someone who is straight. And she did qualitative interviews with siblings who had a lesbian or gay or bisexual sibling and asked them, about their experiences, how it influenced their relationships, their interactions with other institutions like faith organizations, and maybe actions or choices that they made. You'll note that she found 4 themes from her qualitative research: that these siblings are often performing a lot of emotion work or family mediation, that they are having to cope with anti-gay practices, that they are sometimes experiencing courtesy stigma, which is kind of gay by association, and also courtesy group membership, but feeling a little bit in and a little bit out of the lesbian, gay, bisexual community. So as you read this through, I hope you'll think about kind of how this helps you understand either your own or someone else's experience. And, I'm hoping it might inspire conversations for you that listening to these interviews, you might come up with a question you'd like to ask someone close to you. As a transgender man who identifies also as a mom, Dozier expands on a few concepts that we're covering in this lecture: binaries, heteronormativity, queer theory, and also some things that we covered in the feminist family theory lecture in the last module: doing gender, the separate spheres, ideology, and household labor. And also, Dozier introduces this new concept of homonormativity. So how do Dozier's examples kind of expand your understanding of these concepts? Okay, so as we move into sensitive topics in this lecture and our next one on race and ethnicity and social class, I'm going to suggest some possible ground rules, and you can feel free to add in yours in class or in online discussions. I'm going to suggest that we take responsibility, of course, for educating ourselves, but we also are open to learning from one another. That we are firm about countering oppression when it arises in our discussions, even if it's unintentional, but we're also kind and respectful in our responses. That we can share our convictions, but also hear the convictions of others, and that we have permission to share, but we also have permission to remain silent, even if we have relevant thoughts and experiences. Okay, so in this lecture, I'm hoping to avoid just a general presentation on sexual orientation and gender identity, but more of a focus on what do we see in the field of family studies, since this is a family studies class, and to keep it more focused on adults and couples, because we cover kids in other classes and families and parenting in, say, HDFS 334. So in this lecture, first, we're going to talk about concepts related to gender, then those related to sexual orientation, then theories and models related to both, and then some research on same-sex couples. Okay, let's start with concepts related to gender. I'm sure you've heard the term beyond binaries, and both society and the field of family studies has been moving beyond binaries. In family studies, that's been several decades now. What I find interesting about these continua is that they are always changing. I've changed them a lot during the time that I've been teaching this class for the last, 18 years, as we continue to deconstruct sex and gender. So for example, when I started teaching, we just had one continua for gender expression, ranging from feminine to masculine, which meant that if you identified strongly as masculine, you couldn't also identify strongly with femininity. Or an old continuum might be sexually attracted to male or female or both in the middle, but neither wasn't reflected by the continuum, and it didn't reflect that you could be highly attracted to both or minimally attracted to both. So we've gotten more nuanced in how we're thinking about these continua, and also what we've added, things like the difference between being physically attracted and being emotionally attracted. You might ponder how many of these you would be in the middle on. I would be in the middle on a few of these. The field of family studies would also encourage us to think about the salience, which is also called the importance of these identities. So, I might have a gender expression that's kind of moderately feminine with a little bit of masculinity, maybe a little bit of other or androgyny. But how important is that to my sense of self? And so some of these might be more important, and some of these might be less important to our overall identities. So our gender identity is for sure related to our assigned sex and our choices around gender expression, but it's also related to things external to us like attribution or how society perceives us. What box are they putting us in? So similar to what we talked about from feminist theory, gender roles are both individually created and institutionally given to us, societally given to us. So it's that kind of reciprocal process, which also happens with our gender identity. So, for example, perhaps I didn't think of myself as more femme or more butch, but maybe others refer to me that way, and then I start to kind of think of myself like that. Or if we translate this to race, maybe I'm biracial, but because my skin is darker, people often perceive me as black, and so maybe I tend to think of myself more as black than biracial, or at least some of the time. Okay, so I'm going to spend a little bit more time on intersex just because it's the least known concept under kind of sexual orientation and gender identity. And intersex means when we are not clearly biologically male or biologically female. There's about 50 to 75 different intersexed conditions. There's 3 primary ways that we could be intersexed. The first one is that our genotype is not XX or XY, but some sort of variation. So Turner syndrome, girls are X only and missing the Y chromosome, and this is about 1 in every 2,000 female births. Klinefelter syndrome, boys have 2 X's and a Y. That's 1 in about 650 male births, and you may have learned about some of these in HDFS 310. The more common one that we often think about is your phenotype, which is your external or observable genitalia being more mixed or ambiguous. This is more common than most people realize. The older, kind of outdated, now inappropriate term was hermaphrodite, but that's not used anymore. Intersex is used instead. And then the third one is that genotype doesn't match your phenotype. And so one more famous example is the androgen insensitivity syndrome, AIS. It's much more rare. But a young woman might, for example, have XY chromosomes, but not know until she doesn't get her period. And then on ultrasound, we'll find out that she doesn't have any internal female sex organs like a uterus or ovaries. And so what happened was when she was developing prenatally, it's androgens that lead to the development of male sex organs. And because she was insensitive to the androgens that were being produced, it didn't spur her body to create male sex organs. So these are the 3 common forms of intersex. So it's hard to get accurate numbers on rates of intersex, but if you go to the Intersex Society of North America website, you can get more details. But in general, the number of babies whose external genitalia are not clearly male or female is about 1 in 1,500 to 2,000 births. Comparatively, like the rate of Down syndrome is about 1 in 1,000 births. And so it's interesting that Down syndrome is something we all know about, but intersex we don't talk about, nor we don't normalize and educate about more. The total number of people who are not XX and not XY, who have a genotype something different, is about 1 in 1,600 births. And if you take into account all the, variety of ways that people can be intersexed, like missing a testy or an ovary or having something undescended, or, this isn't really my area, but that number is more like 1 in 100. It's pretty common for us to be different from the standard male or female internal phenotype and genotype and external phenotype in some way. So, some of the current recommendations around intersex, especially for children, are that we perhaps just consider normalizing sexual variation. We've accepted variation with other abilities or with physiology, so why can't we allow variation here? For the option for third sex or gender, or just that you identify as one gender, but it's not, the complete standard form. We can also do kind of blood tests to measure hormone levels. Sorry, I had to sneeze. Or measure chromosomes, or we can do ultrasounds to determine the internal sex organs, to check for the presence of a uterus or undescended testes or ovaries. We can, once we have a sense, of what the child wants to do with gender identity, we can use hormones to maybe correct hormonal imbalances. So, for example, a genetic female with a slightly enlarged clitoris might be able to take hormones to reduce the size of that tissue, and perhaps some of those hormones are given around the time when kids would normally be experiencing puberty. We can suspend unnecessary surgeries in infancy and delay them until we're either sure, how a child will identify, or if we still feel like the surgery is necessary. And we can think about doing surgery for sexual functioning over cosmetics. We can also decrease secrecy with kids. Sometimes kids don't even know why they're having repeated surgeries, and so we need to come up with ways to have kind of age-appropriate disclosures and language that really normalizes their experience and gives them ways to explain it if they happen to be with other kids who notice. Okay, let's talk about some concepts associated with sexual orientation. So let's go over some terms, some which maybe you're familiar with, some which may be new to you. So homophobia is more the fear, dislike, or hate of people who are lesbian, gay, or bisexual. Heterosexism is discrimination that favors heterosexuals. Our legal systems have been profoundly heterosexist in the past, and a lot of that has changed. We are now offering marriage, hospital visitation rights, tax benefits, insurance coverage, adoption, and other protections to same-sex couples in addition to just straight couples like it used to be. But still, adoption laws affecting LGBTQ individuals vary by state. Entry into faith-based schools and organizations may vary, for example. So heterosexism still persists in the United States and certainly in other countries. Heteronormativity is more about making assumptions based on societal norms. It's the ideology that heterosexuality is normative and kind of the way to be. It's also like when we assume that people are straight, as the funny clip from Love, Simon illustrates. Heteronormativity includes a few different ideologies within it. And Dozier writes about, for example, the gender ideology. We expect, like when you think back to those continua, we expect that your sex, your gender identity, your gender expression, and your gender role, including your role as a mother or father, are all going to line up, match up, So you can't really be a guy mom, as Dozier identifies as. Sexual ideology or binary means that heterosexual intercourse, like a penis and a vagina, is the gold standard, and everything else is somehow either less natural or less valid, less real in some way. The family ideology or binary basically means that there's a right way to do family and other ways that are less legitimate. And so doing family in the ideal way is a SNAF, the biological mother and father who are non-monogamous, heterosexual, have their own, biological children. Anything else is maybe less genuine, less real. And examples might be a child might not be considered yours if your biology didn't contribute to them, or perhaps your partner doesn't get invited to family events. And then the last term is from the Dozier reading. It's a new term, homonormativity. And Dozier suggests that this is basically society's acceptance of gay and lesbian people as long as they are kind of adhering to heteronormative values. They're presenting in a gender conventional way, they're monogamous, they have two-parent families. And so it means that we've got gay men who aren't feminine, mothers who aren't masculine, parents who are not poor, and as he says, families with two married adults. Bisexuality has been less studied in the field of family studies or psychology, which can lead to this bisexual people feeling kind of invisible in some ways. Research suggests that young women, emerging adult women, are more likely to identify as bisexuals than people of other age or males. Bisexuality can sometimes be a temporary sexual orientation, which is controversial to say because it contributes to perceptions of bisexual individuals as unstable. So that's, I'm acknowledging I'm kind of reinforcing that there. But it can be temporary because you're just exploring same-sex attraction on your way to identifying as gay and lesbian or identifying as straight, or it can be just a clear sexual orientation. People can remain bisexual for many years. There's some variations, mostly straight. So I'm in straight relationships, but maybe I acknowledge my same-sex attractions or fantasies, or bi-curious. I'm not identifying as bisexual right now, but I'm considering the possibility. Biphobia. Bisexual individuals are more likely to be perceived as either hypersexual and kind of eroticized, or unstable or untrustworthy. I really like this concept of master identity status or master status. I find it really useful. So when someone has a minority status in some way, gender, identity, race, sexual orientation, this can often become the most important thing about them. She's a lesbian writer, a gay therapist, my gay son. And so what this means is we are kind of implying that their sexual orientation, or maybe it's their gender identity or their race, is their most important characteristic. And we're kind of ignoring, all the rest of them, right? We've assigned them this master identity. And what I think is most important is who is doing the defining is really important. So if a gay or lesbian person is, maybe they're right now coming out and this is what they're experiencing as their master identity because they're having to empower themselves against a lot of social stigma. And so maybe that was one of the first things they'd want you to know about them. But maybe in other times of their lives, that's not the most important thing. So in the Dozier reading, he talks about, as a transgender man, his YouTube channel is all about his daughter's piano performances and vacation videos rather than anything about kind of coming out as trans. I'll just share an example where I ascribed master status to someone. So I was starting graduate school in 2001, and one of my professors was openly gay, and I found out that she researched gay youth, and I thought, well, that makes sense, because she's gay. And then a couple months later, I also found out that she researched Alzheimer's, and my immediate thought was like, what does that have to do with being gay? Because I had assumed that being gay was her most important identity, and it would dictate kind of all of her interests, including her research interests. So the Brainer reading illustrates a few kind of concepts related to sexual orientation. So Amy Brainer, again, researched siblings who were growing up with or had grown up with a lesbian, gay, or bisexual sibling. They were all kind of emerging adults now. And she kind of did a qualitative study interviewing them about its effects on their relationships with either their sibling, other siblings, families, friends, coworkers, their experiences with institutions like faith organizations, and their sense of self. And she found these four kind of themes and concepts. One is that siblings who have a brother or sister who's lesbian, gay, or bisexual are often doing more emotion work within the family. And emotion work is basically, it's drawn from the work family literature, this concept. It's the invisible work we do to manage our own and others' emotions. Sometimes it's called, invisible work or kin work. These siblings were often having to cope with anti-gay practices, maybe of some faith organizations and how that influenced their own faith journey. Amy Brainer identifies this concept drawn from courtesy stigma, which is drawn from the literature on siblings with disabilities, that maybe because you say you have a gay sibling, now your own sexuality is called into question, that somehow you're gay by association. And then this last one is this idea of courtesy, related to courtesy stigma, is courtesy group membership. So maybe if I have a sibling who's lesbian, gay, or bisexual, I partly feel like I belong in the lesbian gay community, but I also feel like I'm a little bit of an outsider. I'm not sure how I fit in. Brainerd didn't specify her exact questions, but I'm guessing they were something like these, and I expanded them beyond just lesbian, gay, bisexual. And so I'm wondering, for those of you who have a lesbian, gay, bisexual, transgender QI sibling, or if you are, what would your sibling say, or what would you say? How having a sibling has affected your relationships with your sibling, your family members, your friends, or others? How has it affected your experience with institutions, or how has it affected your sense of self or your actions? On this idea of creating dialogue in families, I encourage you to watch this little video where LGBT people talk to their families about coming out. And I want you to think about how does this help you think about conversations that you might have with others that you're close to, and maybe what's one question you would like to ask. All right, let's get into some theories and models related to sexual orientation and gender identity. Queer theory is the predominant theoretical framework related to sexual orientation and gender identity, and it's an outgrowth of feminist theory, specifically gender theory, and also symbolic interactionism, which is another family theory that we didn't cover in this class, but symbolic interactionism is really focused on identity and role and meaning. And so you might kind of recognize this, that like gender theory, queer theory sees sexual orientation and gender identity as a social construction, as is gender roles, race. These are all social constructions at the societal and individual levels, and that the meaning that we make around these identities change over time, both as a society and individually. They can vary. We as people vary in our gender identity and sexual orientation. We vary in the meaning we make about these identities, the salience or importance of these identities in our lives. And all of this is dynamic, and it can change across our lifetimes, both individually and at the societal level. You don't need to know this for the exam, but just to give you a sense of how queer theory might be used in family studies research, this was an article published in a family therapy journal by my friend, Christy McGeorge. Christy and I both went to the master's degree program here at CSU, and she's now a professor at the University of North Dakota. So they were asking this research question: what do Christian pastors see as the impact of family acceptance and or rejection of LGBT family members? And so they conducted interviews with 21 different Christian Protestant pastors, Presbyterians, Methodists, Lutherans, and United Church of Christ, whose doctrine kind of had a range from either being more rejecting or affirming regarding sexual orientation. And the themes in these qualitative interviews that they found were that first, family acceptance can strengthen the family, but it might create external challenges for the family, like, for example, from friends or the faith organization or external family members. That rejection harms LGBT individuals, has greater mental health consequences and a suicide risk, changes their life trajectories, harms family relationships. And that family rejection can either harm the LGBT individual's relationship with their faith organization or religion, or it can strengthen it. And so Coburn and McGeorge used queer theory to suggest that therapists could kind of draw on queer theory to help families deconstruct heteronormativity and hopefully find acceptance and face the external challenges. In the Dozier reading that we're doing, The Power of Queer, Dozier is kind of exemplifying queer theory by kind of queering, deconstructing, questioning heteronormative ideologies by identifying as a transgender man, yet a mother, right? A trans man mom. By being a masculine person, doing feminine tasks. And kind of queering his role in society by being gender nonconforming in gender typical situations, like identifying as a guy mom and bringing brownies to the PTA meeting that is predominantly cisgender women. So as we're thinking about identity and identity salience or importance, you might just ask yourself, which of these is most important to your sense of who you are, and why do you think that is? So minority stress theory by Meyer, this is an outgrowth of family stress theory. And it would acknowledge that LGBTQI individuals experience higher rates of anxiety, depression, substance use issues, suicidality, lower financial and physical well-being oftentimes, but that this is not about just being LGBTQI. It is about the stress and discrimination associated with having those identities. And so minority stress theory would break these down into proximal and distal stressors, proximal being more internal, so internalized homonegativity or fear of rejection, or kind of the stress of not being out or concealing your sexual orientation. I think about this like, the decision that people who are gay all the time have to make to try to correct someone when they assume that you're straight. When the nice man at the Ace Hardware store says to me, like, now you get your husband to help you with that, I don't have to think about whether or not to correct him. But if I was gay, I would have to, right? And kind of my internal battle around that. Distal or external stressors could be experiencing hate crimes, discrimination at work, holding hands in public and someone saying something homophobic. And as we might imagine, holding more than one minority status can exacerbate the stress, associated with minority identities, which will lead us into intersectionality, which we'll talk more about. Okay, so just to give you a sense of how minority stress theory might be used in family studies research, this was a study done on Greek sexual minority individuals got really guided by minority stress theory. It was a quantitative study surveying how the amount of social exclusion and family acceptance they experienced and how that was correlated with their mental and physical health. And social rejection was defined as kind of experiencing rejection at work, friends, unfair treatment in services or in social situations. Family acceptance was defined in the survey items by the family kind of making them feel comfortable about their identity and providing support. And the results found that social rejection was correlated with lower physical and mental health, and family acceptance was correlated with higher physical and mental health. Okay, so this model of transgender emergence was developed by Arlene Lev, who's pictured here, and it's an older model, so you can be deciding how relevant it still is. It's definitely more focused on older teens or adults, not so much around kids. And, of course, as a stage model, we have to know that, there's kind of challenges with that people don't always progress through the stages in a linear way or do them all. But the first stage would be awareness, becoming aware that maybe your assigned gender doesn't fit. And of course, that could be distressing and stressful. And so you might be seeking information in the second stage and reaching out. This can obviously be online. Is probably one of the biggest ways that people do this, but it might be with others as well. And so getting help to kind of articulate what your experience is, normalize, educate yourself. And then disclosing to significant others. Oftentimes this is friends before family members. And that can be an ongoing process of disclosure. It doesn't always it doesn't happen all at once. And then exploration, trying out different identities and labels, presenting, dressing differently, maybe going to places where people might not know you and trying out a different identity. But you could imagine that, like, for some people, they're going to be exploring before they're disclosing, right? Might not go in this order. And then thinking about or moving more into transition, which could be psychological, social, physical. As we move beyond binaries, people might not make a complete transition to another gender, but they might be considering options for body modification, whether that's top surgery or bottom surgery or hormones or laser hair removal. What are they going to do about legal name changes or sex changes, pronouns? So all those types of issues. And then in the sixth and last stage of integration, this is where you're more synthesizing your new gender identity and continuing to adapt to what's emerging in your life. Here's a more recent model that combines gender identity and sexual orientation. It was based on Lev and has some similar ideas, but it isn't a stage model and also allows for more interaction between each of these elements and also takes into account intersectionality, which you see represented there in the middle. So if we start with just awareness, repression, acceptance, this can be like becoming aware that sexual orientation is not straight and our gender is not cis, and we're kind of maybe circling back to levels kind of awareness, repression, and acceptance about this. At the top, developing a personal gender and sexual orientation identity, exploring options for changing it, expression, terms, labels, and again, that this might change over time, right? It might not stay the same. And then kind of sharing identities with friends and family. And again, that can be iterative. We might first come out as a transgender man, then as queer or gay. And with each of those, we might get varying experiences of support or rejection. And then with all this, we're trying to figure out an intimacy status, exploring kind of sexuality and the interplay between sexual orientation and gender identity. So maybe initially I thought I was attracted to women sexually, but really I was a man wanting to be a woman. And once I became a woman, I wasn't as attracted to women. We might be entering and exiting various communities. So yeah, maybe first I thought I was gay, then I decided I was trans. And so when I became trans, I felt like I had to give up some of that, connection maybe to the lesbian women community. And then maybe I move within the transgender community more into, men who want to have sex with men versus men who want to have sex with women. And then we could imagine, we could be circling back through these over time. Of the LGBTQI identities, we have the most research on same-sex couples, and I'm going to just focus on a couple of topics there. There's a lot. A lot has been done on parenting, which we would cover in different classes, but I'm going to talk about intersectionality and relationship characteristics. Okay, so hopefully you remember intersectionality from feminist family theory, and we're looking at the intersection between sexual orientation and race and ethnicity, and also income. And so what research finds is that about 25% of same-sex couples are non-white, and even more so if they have kids. They're more likely to be non-white. Regarding income, if these same-sex couples don't have kids, then they tend to have high income. But if they do have kids, then they're more likely than straight couples to be poor, especially if they are Black or African American. And so children in lesbian and gay households have 2 times the poverty rate of children in heterosexual families. So something important we want to keep in mind for, programming. This study by Steinbugler gets at the intersection between race and sexual orientation by exploring interracial couples, and finds that they have this kind of paradox of being both hyper visible because now they've got 2 different stigmas, right? Homophobia and racism, but they also can be hyper invisible because people may assume that they can't be a couple. They must just be friends. Okay, so if we look at the intersectionality between being gay or lesbian and also living in a rural area, we see that about 12% of same-sex couples live in rural areas, with lesbian couples much more likely than gay male couples. People who are living in rural areas are more likely to be poor, whether straight or gay. Rural residents do report higher experiences of heteronormativity, that there are more negative perceptions of sexual minorities in their communities. They report discrimination in banking, employment, victimization in various forms of harassment, property damage, or physical assault. Lesbian or gay individuals living in rural areas report more of a need to conceal their sexual orientation, that it can be harder to form community, and they may be more reluctant to seek health care. Yet, living in a rural community can also give an increased sense of privacy, and coming out can sometimes lead to more acceptance among rural community members. In terms of immigration status, we can see that as of about 2010, and I don't have more recent data yet for you, about 12% of same-sex couples have a partner who's not a U.S. citizen. Immigration had been harder to legalize through marriage, giving someone residency status, but as of 2012, deportation guidelines do define same-sex couples as families. If we think about the intersection between disability status and sexual orientation, people who are disabled are more likely to be perceived as asexual or kind of infantilized. Their reproductive rights may not be recognized, and if they identify as lesbian, gay, or bisexual, they feel more invisible in terms of their sexuality than heterosexual individuals. And this is also correlated with a lack of sex education and services for all disabled individuals, but definitely for lesbian, gay, bisexual disabled individuals. I want to give you a kind of big picture sense of the research on same-sex couples as I understand it. So initially, researchers in the field of family studies were countering the belief that same-sex couples were harmful to kids. So that was representing kind of basically alpha bias, that same-sex couples are somehow bad or deviant, and that's exaggerating their differences between them and straight couples and ignoring the similarities. So I think researchers really went for this, we are the same. It was initially kind of designed to prove the similarities, which, as you might imagine, was kind of a pendulum swinging over to the other side, the other extreme of beta bias, so that proving all the different ways that children of same-sex couples had similar levels of well-being and academic performance and, things like that. And so now when you think about kind of the pendulum swings from one extreme to the other, and perhaps we're coming back to the middle, now we're thinking about just the challenges associated with the discrimination of being lesbian, gay, or bisexual, or in a same-sex couple, and what are also the unique strengths. But researchers in the field of family studies have kind of asked this question: should we be comparing same-sex couples to heterosexual couples, or is this just another form of heteronormativity, of making heterosexual couples the norm by which everything is compared to? And should we instead just be exploring the unique experiences of same-sex couples? So in the research that follows, I'm going to do a little bit of both. A couple slides on comparison and a couple of slides just on the unique experiences of same-sex couples. Okay, so in terms of comparisons to straight couples, gay couples are more likely, to report, and it's well documented, the strain of heterosexism and homophobia, whether that's less legal rights, inhibited public affection, fears for safety, maybe less likely to be out to others about their relationship, fearing that rejection, and being more likely to use family of choice than family of origin, especially if the family has not been accepting. So many studies have found that lesbian and gay couples tend to be more equitable in terms of paid work, childcare, and housework. Yet at the same time, they are still doing and undoing gender, and one person might be doing more child labor and one person might be doing more paid labor. Researchers have also found that compared to straight couples, there might be higher rates of non-monogamy, but this can tend to be functional for gay male couples and be associated with the relationship longevity. And that also same-sex couples are more likely to have relationships that cross race, class, and age groups. As we're going to see when we get to relationship formation, people often choose someone who's similar to them in terms of demographic characteristics, but whether because they have a smaller dating pool or because they've kind of deconstructed difference and are more open to people from different backgrounds, gay, lesbian, and bisexual individuals are more likely to have someone from a partner who's of a different background than them. So as I mentioned, early research on same-sex couples focused more on comparing them to straight couples and looking for evidence of similarity. But now more recent research has not focused so much on between group comparisons, but just within group understanding. And so we have a few slides on Lavner's research studying, which was a systematic review of studies from 2000 and later, on lesbian couples. And lesbian couples are more likely to be studied than gay male couples. Whether that's researcher preference or who's going to show up for a research study, I'm not sure. But we're going to review kind of a few different types of factors related to lesbian relationship satisfaction: individual factors, couple factors, and external factors. And some of the women in these lesbian relationships would identify as bisexual or queer rather than lesbian. Okay, so in her systematic review of lesbian couples' relationship satisfaction, Lavner summarized the individual couple, and external factors. This is the slide on individual. And so Lavner found there were 3 things that were correlated with lower relationship satisfaction. The first one was internalized homophobia, which actually was interestingly was different than your degree of outness. Degree of outness could be separate from internalized homophobia and didn't actually consistently predict relationship satisfaction in either direction. Neuroticism or anxiousness, higher neuroticism was correlated with lower levels of love, greater declines in love, and a more negative view of the relationship. Higher depressive symptoms were correlated with lower relationship satisfaction and love. In terms of the 3 things that were correlated with higher relationship satisfaction, having attachment security, this was just one study in the systematic review, but there were higher rates for having a secure attachment as compared to an anxious attachment, but there was no correlation for avoidant attachment. Differentiation of self, you remember that concept from family systems theory. This was just one study comparing couples where both were high or both members of the couple were low. And remember, differentiation of self is basically your ability to self-soothe, be one's own person, be non-reactive, not be enmeshed or fused. And then positive affectivity, having more of that was correlated with higher relationship satisfaction. And this positive affect could be things like kindness, tenderness, fun, and laughter. Okay, and so then in Lavner's systematic review, these are the couple factors that predicted relationship satisfaction. And these studies in this part of the systematic review included both straight and gay couples and reported similar findings regardless of sexual orientation. So higher levels of conflict or the demand withdrawal pattern, kind of criticize withdrawal, which we're going to be talking more about, were correlated with lower relationship satisfaction. Having good problem solving skills, higher relationship satisfaction, partner affection and humor, higher satisfaction with division of labor, higher. In terms of sexuality, there is some evidence that lesbian couples have less frequent sex than straight or gay male couples, but that sexual satisfaction is still important for relationship satisfaction. And then how similar you are to one another. So even though there's a greater kind of difference in terms of race, gender, and class, the more similar lesbian couples were in terms of religiosity, how much alcohol they drank, their social involvement, or their self-disclosure, their outness of their sexual orientation, predicted their relationship satisfaction. But again, that could also just be their perceived similarity versus their actual similarity. And then, of course, not surprisingly, commitment. Higher levels of commitment are associated with greater relationship satisfaction. In terms of external factors, work-family stress can reduce relationship satisfaction, and we would see that in straight couples too. So, for example, having less autonomy or less flexibility at work or higher work stress. Financial stress, similarly, can erode relationship satisfaction for all couples. And then for lesbian couples specifically, experiencing minority stress, which we've talked about, having family and friends have more negative reactions to their partner or their relationship, and just everyday discrimination, whether that's kind of fears of it or it actually occurring, being treated with less respect when you're just out to dinner, for example. The more you are experiencing that, the more it can be eroding relationship satisfaction. And then interestingly, social support, which we would expect to just, be correlated with, the more social support, the better, right, for relationship satisfaction. Some of the studies that Lavner reviewed found that, and then some found that it just wasn't statistically significant. It didn't mean that lower was better, there was no statistical relationship. So more research is still needed in that area. Okay, so these authors reviewed research over a 16-year period, starting in 2000 up to 2016, of kind of strengths in same-sex couples. And these were they weren't in comparison to straight couples, but just what were the strengths for same-sex couples. So the first one is just respecting and appreciating differences. So viewing our different backgrounds or personalities or skills as a benefit or an asset, and that it's okay to respect those differences. Positive emotions and interactions, so kind of having the strengths of understanding, warmth, affection. One study found that same-sex couples were likely to mutually support one another's health. They might reframe external stigma as a way to kind of keep them unified or empowered. Communication, kind of emphasis on solving problems, expressing feelings, negotiating differences. Emotional intimacy as a strength, and sometimes even more important than sexual intimacy, so spending time together, having shared interests. Many same-sex couples attributed their relationship quality and their longevity to the strong commitment that they had to each other. And then many reported kind of egalitarian ideals, this freedom from kind of rigid gender roles, being able to be equal partners. And yet, of course, sometimes they overestimated their equality, which can be common, which is the same for straight couples. We think we're more equal than we actually are. So again, these are just across a bunch of studies. Of course, they are big generalizations that don't apply to all same-sex couples, but might give us some idea of the strengths that same-sex couples report and experience. Okay, this felt like a long one. Great job making it to the end.